Well, welcome back. Today I'm going to be talking about the axial skeleton, which is part of the skeletal system. So, the skeletal system, a quick overview, is composed of bones, cartilages, joints, and ligaments. And so, we're not just going to be talking about bones, we're going to be talking about the importance of cartilage and joints and ligaments. And the bones, or bones in general, are composed of 20% of your body mass. And like I mentioned, two major parts: the axial skeleton, which consists of 80 bones, and it's further divided into three major parts or regions, which would be the skull or the cranium, the vertebral column, and the thoracic cage. And in another video, I'm going to be talking about the appendicular skeleton, which are basically just your limb. So I'm going to be just giving an overview and just mentioning or discussing the exoskeleton. So even though the skeletal view has, the entire skeletal structure, but I'm only going to be concentrating on the one that's in turquoise, which is the axial skeleton. So as you can see, the axial skeleton consists of the skull or the cranium, and we see here the thoracic cage, and then we're going to see the vertebral column, which extends to, which is also part of the sacrum. And that's really all the exoskeleton. So it might not look like a lot just by you looking at it, but it's actually pretty much extensive. So this is the posterior view of the exoskeleton. You can see the cranium a little bit better. You can see the appendicular skeleton attached to or articulating with to the axial skeleton. So before we get started, let's first talk about bone markings. This is very important. Bone markings are very important because they are sites of muscle, ligaments, tendon attachment on external surfaces. So you might see a little bump in the bones, you might see a little, something that looks like a line, and this is not something you should ignore because a muscle probably attaches there, a ligament attaches there, and so on. Joint surfaces are also important, and these bone markings are also conduits for blood vessels and nerves. And there are certain particular ones I'm going to concentrate on now, which are projections. Whenever you see a projection, something sticking out, we use the term process. And when you see a pit or something just like a shallow groove or something like that, we call that fossa. And then anytime there's an opening, a hole, we call that foramen or meatus. It really just depends on what we're looking at, but I'm going to be walking you along that as we go along. So we're going to start with the skull. The skull is formed by two sets of bones. We have the cranial structure, the cranial portion, and the facial bones. The cranial bones, also known as the cranium, this is where you're going to find the brain in the cranial cavity. This also is important because it provides sites of attachment for your head and neck muscles. And then the other part would be the facial bones, which we see on the anterior portion of the skull, and this is going to be the framework of the face. We have cavities for special senses like the orbits for the eyes, the oral cavity for the mouth or taste, and smell for the nasal cavity. We also have openings for air and food passage, and again this will serve as site of attachment for teeth and muscles of facial expression. So this is just to show you what the cavities look like, we kind of took out the main structures of the bone and just show you what the cavities look like. We have the cranial cavity, of course, which is where the brain will be located. We have the middle and internal ear cavity, so we're going to talk about that when we get to the special senses, but we're also going to be talking about the ear because, your ears are attached to your temporal bone. And there's also nasal cavity, and there are 85 other openings such as foramina, canals, and fissures. I'm not going to be able to talk about all of them, but I will try my best to mention as much as I can. So we have 8 cranial bones. Someone might be like, well, when I see my head, I only see one bone. There's actually 8 cranial bones that are by adulthood will be fused. So the first one I'm going to talk about is the frontal bone, which is the bone of your forehead. We also have air-filled frontal sinuses there. So this blue portion would be the frontal bone. And then on the sides, the top of your head, there are two bones, not the sides, the top of your head, those are going to be the parietal bones. The parietal bones. And again, I'll talk about why we say there are two, even though you might see that it's one. And then we have the occipital bone, which is going to be the bone on the posterior portion of your head, the back of the head. And then the side, where you have the side of your head where your temples are, those are called the temporal bone. I believe that those are, that's a simple way to remember it. The temples, you have your temporal bone. And then we have the not so obvious ones, such as the sphenoid bone. They have structures such as the greater and lesser wings. They have sella turcica, which I'm going to, talk about a little bit more. And then we also have the ethmoid bone, also inconspicuous. We have crista galli. We're going to be hearing about crista galli when we get to the nervous system. Also, we have the creviform plate and foramen. When we get to the special sensus, we'll discuss that. So this diagram is basically, or this image is basically to discuss the sutures. What are sutures? Sutures are immovable joints. Yes, they are joints. The definition of a joint is when a bone connects or articulates with another bone. And the first one I'm going to talk about is going to be the coronal suture. So the coronal suture is going to be the joint that articulates the frontal bone to the parietal bone. If you remember in the previous video where we talked about anatomical terms, the coronal plane, and specifically, the coronal plane divides the body into anterior and posterior portion, and we kind of see that, kind of mimicking that here, the coronal suture. So this is going to be a joint that's going to articulate the frontal bone with the parietal bone. And then we have the squamous suture. The squamous suture is going to articulate the temporal bone with the parietal bone. And another thing to remember, the temporal bone, one of the reason we call it the squamous suture, because this flat part of the temporal bone is actually called the squamous part. So it makes sense that we're going to call it a squamous suture. And then we have at the posterior portion of the head, we have the occipital bone articulating with the parietal bone, and we call that the lambdoid suture, So while we're on this diagram or this picture, we might as well discuss some of the bone features that we can see here. So for example, this pink one right here, we can see a little bit of the sphenoid bone. There's still another view I'm going to show you where you'll be able to see a little bit more. And then this blue is going to be the zygomatic bone, which is going to be your cheekbones. And then not to forget this small green one right here, this is going to be the ethmoid bone that I mentioned earlier. And this lighter purple structure right here, the upper jaw, is the maxilla. Most people think the upper jaw is just by your nose, but actually goes all the way to your frontal bone, to your forehead. And then we see the nasal bone, this deep purple here being the nasal bone. And obviously we're not going to have the tip of the nose because that's made up of cartilage. And if you remember what we said when we did tissues, cartilage is avascular. And when we're talking about the skeletal system, even though cartilage is part of the skeletal system, this is one of the first part that disintegrates when someone dies. And we usually, as a result, do not include that because it's avascular, does not have blood supply. And another feature I want you to know on the temporal bone is that we're gonna see this hole or opening here called the external acoustic meatus, and that should give you a clue that if we have external, we're gonna have internal. So when we look inside the cranium, we're going to see internal acoustic meatus. This is usually, where your ear opening goes. This is one of the places they say not to put a Q-tip in. And then you see a bump right here. So if you touch behind your ear, you're going to see a bone there. And that bone is called the mastoid process. And we see another smaller pointy one here called the styloid process. So the easy way to distinguish between the two is that mastoid sounds like massive and styloid sounds like stiletto. So mastoid process, styloid process. The mastoid process you can definitely feel on your body, but you will not be able to feel the styloid process. And then we have the lower jaw, which is called the mandible. And we have a hole here called the mental foramen. Another thing I wanted to just mention about the foramen is that usually those holar openings are where nerves are going to pass through. I guarantee you, like 90% of the time, if you guess a nerve passes through a foramen, you're going to be right. And then not to forget the alveolar processes. This is the portion where our teeth insert into our bone. So let's move on to the next diagram. So again, this is just the notes for the sutures to help you out. Sutures are important, but more importantly, you have to know the bones that they articulate with. So again, this is just to show you the separation between bones of the cranium and the facial bones. So the next thing I want to talk about here, we have a skull of an infant. I'm not talking, not just a baby. This is obviously a baby, but an infant. And one of the things that you will see are fontanelles. Fontanelles are made up of cartilages. The lay term that we use is that there's soft spots on babies' heads. If you ever, have the ability to hold a baby and just gently touch their, the anterior middle portion of their skull, you're going to feel a softness. And clinically, we especially if we wanted to see if a baby's dehydrated, this is where we, physicians, we can tap this area to see if it's sunken. That means baby's dehydrated. If it's not, then it means they're well hydrated. But you're going to see here, this also explains one of the reasons why we say that these are bones. I mean, they will fuse by adulthood. They will fuse by, not adulthood, even by, preteens. They are going to be fused. But here we can definitely see the coronal suture. We see, anterior fontanelle. We see the posterior fontanelle. Because of the size of the posterior fontanelle, is going to close a lot quicker faster than the anterior fontanelle. So by the time a child is 3 years old or so, 2 to 3 years old, we might, you might not be able to feel the posterior fontanelle, but the anterior fontanelle, you should still be able to feel a little bit more. And what are the importance of these fontanelles? So this enables a baby to come out of the vaginal birth canal easily. If you see a baby with a cone-shaped head, this is one of the reasons, to just give that flexibility when the baby's coming out of the vagina, and also in order to make sure that the brain grows, because if a baby is born with any of these sutures fused, actually what we're going to have to do is go in there and break it up, because we need the brain to grow. And if the sutures are fused, the brain would not be allowed to grow. So here we're seeing the anterior and posterior aspects of the skull a little bit better, but I want to just concentrate a little bit more on the anterior structure, especially in the orbits. We see, the orbital region. We see the bones that make up the orbital regions. That's going to be the frontal bone. We see, yes, even your zygomatic bone makes up your orbital region, orbit. We see the sphenoid bone, this deep pink inside. We see that. And then we see the maxilla, also part of that. We see the ethmoid bone being part of that. We see even the lacrimal bone being part of that. So there's 7 bones that make up each of your orbits. So this is important in terms of trauma. If someone got punched in the orbit and maybe the assailant is like, yeah, I just punched them in the eye. Well, you could have easily fractured 7 bones just in that region alone. Another one I wanted to concentrate on talk about are the conchae. The conchae are deep inside. I'm going to be talking about them later, and the vomer. And then, as always, we have the mental foramen and the mandible infraorbital foramen. Infra is another word that we use to describe inferiors or inferior to the orbit, right? And then we're gonna see some, going back to the orbits, it looks like there's a crack in the orbital region, the sphenoid bone. And that crack is actually there on purpose. This crack is called the superior orbital fissure. If we have something superior, guess what? We're going to have an inferior portion. So this is the inferior orbital fissure is going to be seen right here. And let's move on to the next slide. So this is an inferior view, looking from the bottom up, all right? Looking from the bottom up. And these are the structures we're going to see. We've removed the mandible here so you can see better. I'm going to start off with what we call the hard palate, which is the roof of your mouth. We have the maxilla, we have the palatine bone. The maxilla is your upper jaw, so we can see that the palatine process is there, and then we have the horizontal plate being part of the palatine bone. And then we have, I'm going to just talk about the obvious ones, like the sphenoid bone here. You can see way better, right? Remember I said I was going to show you a better picture of the sphenoid bone, and we call this the greater wing. What you're looking at right now is called the greater wing, because if you, take closer attention, you can actually see it looks like wings. And, we can see other parts like the vomer. We can see, we can see the occipital bone here. We can see the temporal bone. The temporal bone is all this yellow portion. The occipital bone is all this brown portion here. And another thing I wanted to just talk about is going to be this opening here called the foramen magnum. This is where the spinal cord is going to enter into the cranium. All right, this is a space. It is found on the occipital bone, and on the sides of the foramen magnum, we have something called occipital condyle. This is where your first vertebral bone, your vertebral column, is going to sit nicely here so that you can turn your head side to side. So you can see here the occipital bone and the occipital condyle. So this is an isolated picture of the temporal bone. Like I mentioned before, you can see the squamous part. This is external acoustic meatus. So we have a squamous part, we have a petrous part. The masser processes are actual bones. It's not as protruding in certain people. And we can see the styloid process. This is a zygomatic process on the temporal bone, all right? So this is obviously going to go to the zygomatic bone. So, if you're being asked where's the zygomatic process, it's not on the zygomatic bone. Instead, it's on the temporal bone. So here we've basically removed the top of the head, right? You can see right here. And I'm going to start off with the frontal bone on the anterior portion, right? The frontal bone, and we see in the middle of the frontal bone, we see the ethmoid bone a little bit better. And what do we see there? We see, a cribriform plate. A cribriform plate, you can actually feel the projection coming right in the middle of the ethmoid bone. And the very tip of that is called the crista galli. The crista galli is important because your meninges, your dura mater, actually it's attached firmly to the crista galli. So let's say in terms of, deceleration, someone slams on the brake, your brain tissue, your actual brain would not hit the skull. So the dura mater kind of holds it back so that the brain doesn't crash or smash against your bone. And then you can see these tiny, tiny holes in them. Remember I said cribriform, they're called foramen. This is called cribriform foramen. And we're going to see, like I mentioned, most likely a nerve passing through, and that's going to be the olfactory nerve. So the olfactory nerve that goes to your nose, which is, it makes a perfect, a perfect place to be. The olfactory nerves are going to pass through there. And, this is, before airbags were invented or made, a criteria for cars. If someone fractured their ethmoid bone, whether they hit their head on the on the dashboard or steering wheel, we see that they can lose their sense of smell, and that's because the olfactory nerve passes through there. And another thing we're going to see are the sphenoid bone, this bright pink color. All of this is a sphenoid bone. There are certain parts to it. The lesser wing is going to be the top portion, the lesser wing of the sphenoid. Then we have the greater wing of the sphenoid, seen at the, just inferior to the lesser wing. And in the middle of the sphenoid bone, we have what we call the hypophyseal fossa of sella turcica, or you can just call it sella turcica. And this is important because this is where your pituitary gland is going to be located. The pituitary gland produces majority of the hormones in your body, so we definitely would not want anything to happen to it. So remember, I also mentioned the external acoustic meatus. We're going to see the internal here. We see the petrous part of the temporal bone. And again, we're seeing the foramen magnum. So here's just another view of the sphenoid bone, but here you can see the sphenoid sinuses. And sinuses are spaces in your cranium, which we're going to get to and talk about later. So we have here the ethmoid bone, which is the superior part of the nasal septum. It makes up the roof of the nasal cavities, and it basically contributes to the medial wall of the orbits. And most importantly, the ethmoid bone is still part of the cranium, all right, part of the cranial bone. And one of the things you can see here is the crista galli. The crista galli is the part of the ethmoid bone that kind of sticks out of the ethmoid bone, and we're going to talk about the crista galli also when we get to the nervous system. Its job is for dural attachment. The dura mater is one of those membrane that encloses your brain and basically holds it. So let's say there's a fender bender, the head is jerked forward. The job of the dura mater is to hold the head back so that your brain does not slam against the bone, and that attachment is on the dura mater. So one of the other things you will see is the ethmoidal cells of the ethmoidal sinus. So the sinuses, the previous slide I showed you the sphenoid sinus, and the sinuses are basically empty spaces in your cranium to lighten the skull. And sometimes when the sinuses are filled with mucus, in cases of cold, it feels heavy because usually there's nothing in those sinuses. And another thing you can see here are the mesonasal conchae and the perpendicular plate of the ethmoid bone. So there are 14 facial bones. Yes, 14 facial bones. We have the mandible, which is the lower jaw, and the maxilla, which is the upper jaw. And the maxilla, the thing about the maxilla is actually goes all the way to your orbit. So the maxilla, even though it's upper jaw, it doesn't end at the level of the nose. It actually goes all the way to your orbit. And this also contains the maxillary sinuses. The vomer, you can't see it in this view because it's a lateral view. But this is where you're going to find the inferior nasal septum. And we have the nasal bones, which makes up the medial wall of the orbit. There's the lacrimal fossa, which is going to be where the lacrimal sac will be located. The lacrimal sac is what the lacrimal sac contains the lacrimal gland, which is the gland that makes your tears. The zygomatic bone is basically your cheekbones. And we also see the lacrimal bones. There are two of them. They make up the bridge of the nose, very close to the nasal area. The palatine bone, it makes up the posterior 1/3 of your hard palate. What's the hard palate? The hard palate is the roof of your mouth. There are two bones that make up the hard palate. So I just said the palatine bone makes up a third of the hard palate. The maxilla will make up the 2/3, so that forms the roof of your mouth. And the palatine bone also forms the posterolateral walls of the nasal cavity. So, for example, in cases where someone is born with cleft palate, either some or part of the, or all of the, usually it's not all, but some of the palatine bone or the maxilla bone did not fuse properly. So there's a connection between the nasal cavity and the oral cavity. And then there's the inferior nasal concave, which forms the wall of the nasal cavity. So here is the lower jaw. This is the largest, strongest bone of your face. The common or popular temporomandibular joint, the TMJ. This is the only freely movable joint in the skull. We have the joints. The sutures are immovable joints. I'm going to talk about the joints in another video. But here is going to be the temporomandibular joint, where the temporal bone of your cranium articulates with the mandibular bone. That's where we get the word the TMJ. So let's just look at some of the parts of the mandible. The condyloid process. This is the part that's going to articulate with the mandibular fossa of the is going to articulate with the temporal bone. And then we have here the coronoid process. You can see the mandibular foramen here. Usually foramen, I mentioned, are openings, and most of the time, if you had to guess, a nerve passes through there. And you can see the alveolar process. The alveolar process, this is where your teeth insert into the bone. So here we also have the body of the mandible, we have the mandibular angle, we have the ramus of the mandible, which is the side of the mandible. Here we can see the bones forming the left lateral wall of the nasal cavity. Here is a lateral view. The nasal septum has been removed. So you can basically see the nasal concave in relation to the ethmoid bone that we just talked about. In this slide, you can also see the frontal sinuses. You can see the ethmoid bone, like I mentioned. But more importantly, I wanted you to see the superior, middle, and inferior nasal meatus. So it's, when you inhale, one of the things people don't understand is there's almost like a passageway for all of that incoming air to go in. It doesn't just go in, in a rush and just kind of finds its way. So the superior, middle, and inferior meatuses, these are going to be passageway for incoming air to pass through. So this is also another view to show you the maxillary bone and the palatine bone forming the roof of your mouth. And this is a very good picture of the sphenoidal sinus, and you can see the pterygoid process of the sphenoid bone also. So now onto the orbits. So the orbits, they are cavities that encase the eyes and the lacrimal gland. They're site of attachment for eye muscles. And yes, there are 7 bones that make up each orbit, not all the orbits, each of them. They are the frontal bone, the sphenoid, the zygomatic, the maxilla, palatine, lacrimal, and the ethmoid bone. So now let's see, am I right? Am I correct? Let's count. So here we have the yellow one here, which is a frontal bone. And then we have the maxilla bone right here. We also have the sphenoid bone, like I mentioned. And here is the zygomatic bone forming the lateral walls of the orbit. The frontal bone forming the superior wall of the orbit. And we also see here, you can see a little bit of the palatine bone. It's not labeled, but it's there. We can see this small tiny piece right here, the palatine bone, the orbital process of the palatine bone. And then you can also see the lacrimal bone is this green portion right here. And then, we cannot forget the ethmoid bone. So right here, this orange portion is the orbital plate of the ethmoid bone. So this is especially important, especially when it comes to trauma. And someone might say, "Oh, I just punched someone in the orbit." And what do you mean I fractured 7 bones? Yes, in one area, in just one orbit, there are 7 bones that make up that orbit. So one of the things I also wanted to talk about are the orbital notch, and infraorbital foramen. The supraorbital foramen is not very visible on this picture, but infraorbital foramen, a nerve is going to pass through here also. So let's move on to the nasal cavity. The nasal cavity, the roof, lateral walls, and floor is formed by these four bones: the ethmoid, the palatine, the maxillary bones, the inferior nasal conchae. And then there's the nasal septum of the bone and the hyaline cartilage, which is going to be made up of the perpendicular plate of ethmoid, the vomer, and the anterior septal cartilage. So here it is. We can see again the ethmoid bone, the crista galli, the cribriform plate, seen here, and there are holes in there. And I mentioned earlier in on the previous slide about if the ethmoid bone is fractured, then sense of hearing might be lost because the olfactory nerve located there could be affected. And that's here you can see a tiny hole or spaces. This is where the olfactory nerve are going to use to pass into the nose, pick up the sense, the sense of smell, and the job of the olfactory nerve is not to interpret what you're smelling. Their job is to pick up that smell, and it's the job of the brain, the function of the brain, to interpret that, like, that smells like vanilla, that smells like coffee. The olfactory nerves cannot interpret that. That's going to be the job of the brain. So one of the things you can also see here, like I mentioned, the septal cartilage, the nasal bone, of course, the vomer, and then we can see the not only the sphenoidal sinus, but the sella turcica, which the pituitary gland is going to be found there, the pituitary gland. So this diagram is basically just to show you where all the sinuses are located. We have the frontal sinuses. If it's congested, you can get a headache from that. We have the ethmoidal sinuses here. We have the sphenoidal sinuses, and the largest one is the maxillary sinus. So these sinuses are mucosa lined, which is, there could be proliferation of mucosa, of mucus rather. When someone is someone is sick, has a cold, they're air-filled, they lighten the skull, as I mentioned, they enhance the resonance of voice. So let's say you're talking to someone on the phone, they didn't tell you they have sinus congestion, but you can hear it. You can hear it because there's no resonance of voice. They also warm and humidify the air. They're found in all these bones: the frontal, sphenoid, ethmoid, and maxillary bones. So another bone we're going to talk about, part of the axial skeleton, is the hyoid bone. This is not bone of a skull. It's a very unique, I like to call it a Jeopardy question. It does not articulate directly with another bone. It kind of stands alone. Obviously, it has ligaments, it's attached to muscles, and these muscles that are attached there are basically for swallowing and speech. And, I'm not going to go into details about the parts of it, but the significance of the hyoid bone, especially when it comes to forensics, is that if we're looking at strangulation or suicide, what we see is that the hyoid bone could be broken. So, forensically, they're like, oh, how did they know that the person was strangled or they died by suicide? Once the hyoid bone is fractured, it can occlude or obstruct the airway. So onto the vertebral column. So the vertebral column increases resilience, flexibility of the spine. I don't really like using the spine because it's so vague. But we do have, looking at this view, especially the lateral view, you can see the cervical and the lumbar curvatures, and we also see the thoracic and the sacral curvatures. So what we're basically saying is that the cervical and the lumbar curvature will be similar. They're concave shaped, and the thoracic and the sacral curvature are going to be convex shaped. And they transmit the weight of the trunk to the lower limbs. That's the job of the vertebral column, and most importantly, their job is to surround, protect the spinal cord. They have flexible curved structures. There are 26 irregular bones in 5 major areas. We have the cervical vertebrae, 7, the vertebrae of the neck. We have the thoracic vertebrae, which is 12, the lumbar vertebrae, which is 5, sacrum 5, and coccyx 3 to 4. So even regardless of how tall or short someone is, they have the same number of bones. I've had students ask me, so, but what if someone is 7 feet tall, 6'5", and you mean to tell me, a female who's 5 feet tall also has the same? Yes. The number of your bones does not increase based on your height. Obviously, it might be bigger, if someone is taller, and smaller if someone is smaller stature. So the cervical vertebrae, if you haven't seen the anatomical video that I discussed anatomical terms, go back and look at that. That's a vertebrae of your neck. And then the thoracic vertebrae, you're thinking the thoracic cage, 12 bones. And the thoracic vertebrae, all of them are going to articulate with the ribs. There are 12 ribs, 12 pairs of ribs, so it's a perfect union. And then the lumbar region is the lower back, so we see this as a vertebrae of the lower back. And inferior to the lumbar will be the sacrum, which is 5 bones, and the coccyx, which is 3 to 4, which we commonly refer to as the tailbone. So I just mentioned the curvatures. Those are the normal curvatures. So now let's look at abnormal spinal curvatures. The first one is going to be scoliosis. Scoliosis is abnormal lateral curvature of the thoracic vertebrae. Not the cervical vertebrae, not the lumbar vertebrae, thoracic vertebrae. So it could either be right lateral or left lateral, but it's moving to the side. And then there's another one called kyphosis. This is commonly known as the hunchback of Notre Dame. This is abnormal posterior curvature of the thoracic vertebrae. Again, not the cervical, not the lumbar vertebrae. Posterior curvature. Do not confuse that with the lateral curvature of scoliosis. All right. And this is one of the reasons why grandma or grandpa shrunk. You're like, oh, I thought, grandma or grandpa was this height. What happened? It looks like she shrunk. Well, yeah, she has posterior curvature of the thoracic vertebrae. And then the last one is lordosis. Lordosis is going to be abnormal anterior curvature of the lumbar vertebrae. Here we see in this diagram, in this picture, a pregnant woman, right? So the belly is protruding forward, and by that it's pulling, almost like it's pulling the lumbar vertebrae anteriorly. We also see this in lordosis can also be seen in obese people or in pot-bellied men, and this could cause backache. So this is showing this diagram is just there to show the intervertebral disc. When we talk about someone having herniated disc, I also have an MRI where I'm going to show you what that looks like. But the intervertebral disc is fibrocartilage that we see at the after each of your vertebrae. So another thing that all throughout your skeletal system, after every single bone, there's cartilage. Most of the time, it's going to be hyaline cartilage lining, covering the ends of your bone. But for the vertebral column, what we're going to see is fibrocartilage, because we need something a little bit tougher, a little bit thicker, jumping up and down, moving. You don't want a situation where the bones are going to smash against each other. So the intervertebral disc is a cushion composed of 2 parts. There's a nucleus pulposus and annulus fibrosus. The nucleus pulposus is more of a inner gelatinous nucleus. It gives its elasticity, its compressibility, and the annulus fibrosus is where we're going to find this collagen, fibrocartilage. And why is this important? This is important when we're talking about herniated disc. I'm going to show you in the next slide. But before then, I just wanted to show you another thing called intervertebral foramen. What is intervertebral foramen? This is the spaces we have in between when we stack the vertebral vertebrae together, the spaces is what we see. Do not confuse that with the vertebral foramen, which I'm going to talk about. So in the intervertebral foramen, we're going to see the spinal nerves coming off of the spinal cord. And as always, you're going to see ligaments, because the job of ligaments is to connect or articulate one bone to another. We're not going to see tendons here, because the job of tendons is to articulate bone to muscles and vice versa. So here we're looking at a herniated disc, a herniated intervertebral disc. And one of the things that you would notice is that, based on the previous slide I talked about, the annulus fibrosus and nucleus pulposus being inside the gel inside, you're going to see that the annulus fibrosus is protruding and basically pinching on that nerve and touching that nerve that's coming off of the spinal cord. So in this situation, we're able to tell physical therapy might be a better option than surgery. We're going to try that first. And if that doesn't work, then, we might have to move on to surgery. But we still have an intact annulus fibrosus of the disc. The nucleus pulposus has not yet been spilled out. And this basically also shows how patients experience this pain, because you have this hard cartilage, the fibrocartilage, basically, just pinching and irritating that nerve. And while we're on this diagram, I just wanted to discuss the other parts of the vertebrae that we see. The vertebrospinous process. This is the one that you'll be able to feel, and you'll be able to feel this on your, when you touch your back, and the transverse process goes on the side. So this is an MRI of the lumbar region of the vertebral column. So one of the things you can see here is herniated nucleus pulposus. So this, you can even see on the interior portion, we are missing a lot of the intervertebral disc. So this, because nucleus pulposus is spilled out, physical therapy is not really going to make any major recovery or alleviate the symptoms of the patient. We're going to have to do surgery and replace that herniated disc. So when we're looking at MRI of a lumbar region, at least we know, not just, someone has a herniated disc, but we need to know, do they have the nucleus pulposus herniated, or do they have just the annulus fibrosus portion of the disc herniated? So let's look at the general structure of the vertebrae. It consists of the body, the vertebral foramina or foramen, and the intervertebral foramen, which I mentioned earlier. So here you can see I mentioned the spinous process. We have the transverse process, and by the way, all of them are going to be different depending on whether you're looking at the cervical, thoracic, or lumbar. So the spinous process is going to project posteriorly. These are the transverse process, projecting laterally. And then we have what we call articular processes. Articular processes are whether superior will protrude superiorly and inferior will protrude inferiorly. This is where other vertebrae are going to articulate. So basically, there's a space for each of these vertebrae. So this opening right here is going to be the vertebral foramen, and this what we call the body or the centrum. This is going to differ because the job of the body is to carry weight. So the lower you go in the vertebral column from cervical to lumbar, the body of the cervical of the vertebrae will get bigger. The cervical vertebrae will have the smallest body, while the lumbar vertebrae will have the biggest body, because the lumbar vertebrae basically is there to carry your entire trunk, the abdominal contents, the thoracic contents, including the head. And in between the spinous process and the and the transverse process we have on the sides are called lamina. So onto the cervical vertebrae. So the cervical vertebrae, another thing I wanted to say, to remind you, we have 7 cervical vertebrae. The way to remember it is that you have breakfast at 7 a.m., the thoracic, 12 of them, you have lunch at noon, and then the lumbar will be 5. So dinner at 5 p.m. So I don't know if that's going to help you. So cervical vertebrae. So the cervical vertebrae, C1 to C7, they're the smallest, lightest vertebrae. And C1 and C2 are very unique, but we'll discuss that in a bit. But C3 to C7 have these features. They have the oval body, all right, the body that carries the weight. They have a bifid spinous process, except C7. What does that mean? The spinous process splits into 2. This is very unique. So even if someone shows you a vertebrae and you're not sure, okay, I know it's small, because sometimes, especially when you have like C6 and T1, they might be similar. Just look at the bifid spinous process. It also has a large triangular vertebral foramen, and another thing is going to have transverse foramen in each process, which you're not going to see. You're not going to see transverse foramen in any of the other vertebrae. So this makes it very, very unique. So here you can see the bifid spinous process, like I mentioned, except in C7. So C1, we call C1 the atlas, we call C2 the axis. They have unique features and you have to know them. One of the unique features that C1 has is that it has no body and it has no spinous process. So no body, it's not carrying any weight, and no spinous process, nothing sticking out. And the superior surfaces will articulate with the occipital condyles. If you remember, I mentioned the occipital condyles, and they are the ones at the opening of the foramen magnum. All right, so there's a spot, and this atlas, the atlas's job is for the movement of yes. So you can see that their superior articular facet is seen right there, and then their transverse foramen very small, and obviously their transverse process would not resemble the ones that we would expect to see in thoracic or lumbar. This is the axis. The axis is also known as C2. It has something very unique, and what we see there is the dens or the odontoid process. This pointy thing right here, this projects superiorly into the anterior arch of the atlas, and it's a pivot for rotation of the atlas, and the axis plays a major role in the movement of no. So let's say someone has a fracture of their axis, they would not be able to move their head laterally to say no. So here's the thoracic vertebrae. The thoracic vertebrae, if you remember, this is when we talked about the general structure of a vertebrae. And this one goes T1 to T12, and as I mentioned, all will articulate with the ribs at the facets. They have long spinous process that points inferiorly, and their vertebral foramen, where we're going to find the spinal cord right here, is going to be circular. And the location of their articular facets actually allows for rotation of this area of their spine. And you can see your superior articular facet and then the inferior articular facets in there. So, like I mentioned, their spinous process will project a little bit more inferiorly when you compare it with the other types of vertebrae. And here is the lumbar vertebrae. One of the things you will notice is that it has the largest body. It's going to be a very big vertebrae. It goes L1 to L5. And one of the unique features we'll also see is that the vertebral foramen starts to narrow down because your spinal cord actually ends at the level of L1 to L2. So the spinal cord ends and there's no need for that big vertebral foramen anymore. It also has short, thick pedicles and laminae. So that makes it very unique. It has flat spinous process that point in posteriorly. And like I mentioned, the vertebral foramen is going to be triangular. And as a result of the articular facets, it locks the lumbar vertebrae together to prevent rotation. So this is important because sometimes people are trying to crack their back, twist, but you are actually moving the thoracic vertebrae. You cannot move the lumbar vertebrae based on the locking of the articular facets. So here's an image of what the lumbar vertebrae will look like. And we're on to the sacrum. The sacrum, there are 5 sacral bones. Someone might say, wait a minute, I see 1 bone. And maybe the coccyx, what do you mean 5? But these are 5 fused vertebrae. So when you're born, children, you can actually see they are separate. They're separate sacral vertebrae. They form the posterior wall of the pelvis, and they articulate with L5 superiorly and with auricular surfaces of the hip bones, and by doing so they form the sacroiliac joints. And we cannot forget these holes. These are called sacral foramen or sacral foramina. These are where nerves are going to pass through. And since we are here, we'll discuss the coccyx. So that was the anterior view, and here is the posterior view. So here's a posterior view. You can see the median sacral crest. You can see the posterior sacral foramina. This is considered the body. All right, this is considered the body, and this is going to be this facet of the superior articular process, and this is going to be considered the sacral canal. All right, the sacral canal. And like I mentioned, the coccyx we commonly refer to as the tailbone. That's obviously not the anatomical term. They are 3 to 5 fused bone as well. This articulates superiorly with the sacrum. So onto the thoracic cage. The thoracic cage is composed of the thoracic vertebrae posteriorly, the sternum and the costal cartilages anteriorly, and the ribs laterally. And what's the function? To protect these vital organs like your heart, like your lungs, and it supports also the shoulder girdles. This is where the shoulder girdles, your upper limbs, this is where they attach to, and also providing muscles of attachment for muscles of the neck, back, chest, and shoulders. So let's take a look at the thoracic cage. So like I mentioned, we have the sternum here. You have to know parts of the sternum. There are 3 fused bones. Superiorly, we have the manubrium, which is the first bone, and obviously it's also fused. On the manubrium, we have the jugular notch. Most people should be able to feel the jugular notch. And then there's also a clavicular notch. The clavicular notch is where the clavicle, which we're going to talk about when we get to appendicular skeleton, the clavicular notch is going to articulate there. And the ribs are also going to articulate on the manubrium. The mid portion is called the body of the sternum, right? This is going to articulate with the costal cartilage. These blue things are costal cartilages. They're made up of hyaline cartilages. And the very tip is inferior end, which is the xiphoid process. So here in this diagram is showing it as blue, meaning it's cartilage, but it most likely is going to be bone. For those who are certified in CPR, this is one of the reasons why you take your 2 fingers, you place it on the xiphoid process, not to perform CPR there, but to avoid it. And then you place your palm, you place the bone of your palm, you place it on the body of the sternum to perform CPR. Because we're trying to avoid the xiphoid process, we don't want a situation where, while performing CPR, you puncture the lungs or the heart. We're trying to save them, not kill them. All right. So another thing about the thoracic cage, obviously the ribs. There are 12 pairs, 12 on each side of the thoracic cage, and all of them are going to attach to thoracic vertebrae, which are 12 ribs, 12 pairs of ribs, 12 thoracic vertebrae. And the ribs are paired 1 through 7. The ribs paired 1 through 7, we call them the true ribs. There are 12 of them. ribs 1 through 7, we call them true ribs because, as you can see, they all articulate with the sternum directly. The key word there is directly. All right. The false ribs are ribs 8 through 10, and these articulate indirectly or attach indirectly to the sternum by joining the costal cartilages of the ribs above. So we have ribs 8, 9, 10 are going and articulating with ribs number 7, and therefore we call them the false ribs. And then the floating ribs, ribs 11 and 12, they don't even come up to the front. They don't even come up to the sternum at all, and as a result we call them floating ribs because they have no attachment to the sternum. So that's all for axial skeleton. All right, thank you. Bye bye.